I'm going to call this meeting to order, Mashpee Board of Health, on November 6th at 6:06 PM.
Let me let Justin know.
I let him know.
Okay.
November 4th, Ernie.
Fourth. Sorry about that.
You let Justin know?
Yep, we're on there.
Yep,
Okay.
he gave a thumbs up.
Yep.
Okay,
Want me to repeat that?
you're all set. Go ahead.
We good? What I'd like to is start this meeting, Mashpee Board of Health, on November 4th at 6:07 PM. And as soon as I get this thing to come up.
Do you need an agenda, Ernie?
Yeah, that'd be great, Phyllis. All right. First order of business tonight would be number one, COVID.
Acknowledge due expense warrants first.
Okay.
Ernie, do you want to look at them first, or?
Yeah. Where's that signature?
I think it's, so that's one of them, and then there should be one right underneath this one. We're
Next.
signing two of them, correct?
Right here. No, that's the front.
Or I think three of them, so there's one right here, right here.
Oh, there we go.
There you go. Okay. I think we might have plenty of to sign. Here, I'm gonna pass this over to you to sign. Right here.
There you go, yeah.
And then
Is there another one, or is that it?
one more.
One more?
Thank you.
I would like to comment first that Chairman is not here tonight. I am the co-chair, and we'll conduct this business tonight as best as possible. I start with old business now. COVID.
Well, we have
Or would
folks
you
here,
like to go somewhere?
we have folks here for 192 Ninnegrit, so let's
Oh, okay.
take care of them and get them on their way.
All righty. So we're going to review a request for a Title V variance, 192 Ninnegrit Avenue, Carmen Shea, Shea Environmental.
Okay. I did this. Okay. The owners are here. This is a septic repair for a failed system that was inspected and did not have the 4 feet to groundwater. So there is a proposed design plan that has several variances. It includes a 1,500-gallon fast, innovative alternative septic system, a 1,000-gallon pump chamber, to a 15 by 30-foot leach field, and that is raised with concrete retaining walls. One of the variances is 5 foot to the northern abutter, the northern property line. So the abutter was notified. I did get the green card back from the engineer, so for evidence that the abutter was notified. So the variances that are requested are 7.5 feet from the leaching to the property line, 6.5 feet from the foundation to the proposed soil absorption system, 25% reduction in size per maximum feasible compliance, variance to use the FAST system to reduce the separation from groundwater from 5 feet to 3 feet, and variance to sleeve the water line as it's within 10 feet of the septic tank and pump chamber. The plan has been reviewed. I submitted comments and a revised plan was provided. So at this point, we're happy with the technical end of the plan. The abutter's been notified. So if you have any questions, we'll try to answer them. The owners are here to represent the property and the plan. Unfortunately, the engineer is homesick, but the property owners are here if you have any questions.
Is there anyone present? No, there is not, as far as representing the engineer, right?
Who is?
The owners are here,
Yeah,
but the engineer is not.
the engineer is not.
Okay. But it looks like you've covered what's needed for this. Manny, do you have any comments?
No, I don't think so. Seems to look everything okay. I know there's 2 copies here. I'm just trying to, you said revised plans, so are they both attached in our package?
They were uploaded into our permitting software. I'm not sure if they were the ones that got forwarded to you.
I know that.
This is the updated plan here.
All right, thank you. Do you want to look at them, Ernie? Because I know.
Yeah.
I'm looking at some right here too, so I'm hoping that they're pretty much the same. I'm good with this. Thank you. All right, so.
I'd
we
like to
good?
get a motion to approve the request for Title V variance 192 Minigrad Ave.
I'll do that. So I make a motion to approve the design plan with the conditions that the fast alternative septic system be installed and maintained with an annual O&M per the DEP remedial approval letter at 192 Ninigret Avenue.
Take a vote.
Was that
All in favor, say aye.
aye?
Aye.
You're all set.
Thank you. Have a good night.
Aye.
I'm sorry.
The approval, can you forward that to me in an email? She wants an approval, a decision letter.
Yes, there will be an approval letter for the board's decision.
Okay.
Yep, and we'll send that to you and to Carmen.
Okay,
Tell Carmen that we'll need 2 hard copies of the approved plan.
all right, we'll do. I'll text him tonight.
Yep,
Thank you.
Thank you.
thank you.
Thank you. Okay.
She needs that tomorrow, Glenn, that approval letter.
Mhm.
She needs it tomorrow, so we'll have to prepare that tomorrow.
Okay.
Um, See, our office is here, so I'd like to go to that next subject.
Yeah, 46 Nicoletta's Way, the
Yeah.
positive dog training,
Yes.
okay? I've sent you my comments on that. At the last meeting, the board did have a brief discussion about the situation where the dog training facility had been in operation for about 10 months. There was a cease and desist that was issued to the operator of the dog training facility. And the board asked me as a health agent to get an opinion from council on issuing or getting options for enforcement beyond the fines that were recommended per the regulation. So the opinion did come back from council. That opinion's been forwarded to you. And the proper notice was given to the operator to be here. They are not here. So it's really up to the board at this point to see what you want to do.
Well, at this point, I have read through thoroughly the recommendation from council, and I do not feel comfortable with just 2 of us present tonight. I think this really needs all 3 of us for a discussion to continue on this. Therefore, I would like to continue this, if I can get a agreement on that.
Yeah, I was kind of going to suggest the same thing, that I'd prefer if Brian were to be here, kind of to have a discussion with this and come up with the right amount of fine to issue to the owner and then go from there.
Correct. So I'd like to get a motion to continue positive dog training of Cape Cod at 46 Nicoletta's Way, Unit 10.
I make a motion at this time to continue the discussion for issuing of a fine for positive dog training of Cape Cod at 46 Nicoletta's Way, Unit 10, at the next meeting.
I have a motion, I second it.
All right.
Get a vote, all those say aye.
Aye.
Aye. Approved for continuance.
Okay, thank you. We're all set? We'll go for December 2nd.
Thank you for
Well,
coming.
Thank you for coming.
Just let you know that Mr. Noon has vacated the property. It is now up for lease on Craigslist. So he's no longer in town. We have no idea where he is at this point, but it's either Sandwich or Plymouth.
Okay.
Okay,
All right.
All right.
thank you.
Thank
Thank you.
Thank you.
So I guess it wouldn't really matter if we issued a fine or not, I guess. Kind of reflects what Brian was saying last time, we won't see the money, right?
No, you may.
Going to finish up the new business and do the Board of Health budget?
Yes.
Okay. I put that on the agenda last Thursday when we prepared the agenda. And at that point, Christine and I had a discussion about, well, what we had done was we used the VNA as our town nurse. We are contracted for all epidemiological and infectious disease investigations, and they have been doing our contact tracing. But because last spring there was such a spike, the bills that we got from the VNA were upwards of between $3,000 to $10,000 a month. And we have a $20,000 COVID budget, which was initially set by the board and requested by the board, and that was actually when we thought that we were going to be doing the COVID clinics, the public clinics, and that never came to fruition, but we do have that money that we've used to contact tracing that the VNA has been doing. And to alleviate some of the cost, we actually switched over. We stopped the VNA from doing the contact tracing back in September and went with the Contact Tracing Collaborative, which is the Department of Public Health faction who does the contact tracing for the state. And there's no cost to the towns if the CTC does the contact tracing. So we did that for a month and a half, and then we found out that they are truly going to disband the CTC come the end of December, but the CTC isn't taking any new cases at the end of November, the beginning of December. So we really have them for this month only, and are going to have to find someone else or get the VNA to take up the contact tracing again for December through the end of the fiscal year. So because of the spike last year, we know that, or we have calculated that we're going to run out of that 20,000 of the COVID money that was put in our budget. So we've made a request to the town manager to increase that. And we were going to have the board approve an increase, but we met with the town manager on Tuesday regarding another topic, and I just said, well, just to give him fair warning that I was going to request the board to increase that line item, and he's like, no, I need to know now so that he can work it into his budget for town meeting. So we actually brought Lisa Fry, who is the assistant town accountant, and she came in and said that there was money available this year for the COVID-related items, and then we came up with a figure to increase for FY23. And so the town manager was going to put that in motion and write that into his budget. So at this point, I don't think the board has to do anything, but that figure was going to be 60,000 on top of the 20 that we have in our budget now, just in case we have that spike, which may happen now that people are going to be back inside for the winter time, because January, February, and March of last year was our highest number of cases. So, and as people start to get back outside in the warmer weather, the cases went back down. So that, we did that anticipating another spike this winter. We hope it doesn't happen. We hope we don't use the money, and we can give that, send that back after the end of the fiscal year. So that, at this point, because we've put that in motion, I don't think the board has to do anything at this point, because we've taken care of that administratively through the budget.
Good.
Okay.
Good explanation, and
Yeah.
it's
Fair.
working out well.
Hopefully, we won't be seeing such high numbers, knock on wood, but.
Right. hopefully the kids will get done, and that will also start to decrease the numbers
Right,
with the families.
definitely.
We could do the COVID update, that's a good segue into the COVID update.
Okay, let's do the COVID update.
I'm gonna have Christine do that, she's been keeping up with the COVID topics.
So Glenn already covered, effective December 1st, the CTC will no longer be accepting new cases for contact tracing and will officially close on December 30th. VNA will resume contact tracing services for the town beginning December 1st. The state's most recent dashboard report reflected a positivity rate in Mashpee of 2.39%. The town currently has 13 positive cases. There are currently 9 individuals hospitalized with COVID between Cape Cod and Falmouth hospitals. 2 of those are in ICU. Those are not just Mashpee residents, that's all the patients at the 2 hospitals. Current data indicates that 1 in every 3 cases statewide is a breakthrough case right now. Effective November 2nd, 2021, the Pfizer vaccine is available to children ages 5 to 12. The school nurse coordinator reached out to us this afternoon, to discuss coordinating an in-school vaccination clinic, and we're going to discuss that with her tomorrow and hopefully work with the VNA to coordinate that. We've received several calls regarding booster shots, not a ton, but probably a half a dozen. We're referring individuals to the county health department because they're holding clinics at the Harborview Conference Room at the county complex every Thursday, where they offer first and second doses and the booster. So we're referring folks who are interested in the booster there. We're also letting them know that they can see talk to their primary care and reach out to some of the walk-in clinics. But for the county one, there's no appointment necessary. They'd like you to schedule an appointment, but they're taking walk-ins, so that's good. And that's every Thursday. And we updated the website today with the new information about the vaccination for 5 to 12-year-olds, and we're keeping the website updated with any changes relative to vaccine eligibility and availability.
There was a new booster poster too that the CDC provided,
Yep.
and that's on the website.
Is anywhere that's offering this booster, is that all of the different companies that have come up with a COVID shot, or are there some companies that don't have it?
The booster is
I mean, they're like Moderna.
it's all 3. You can choose which booster, and it doesn't matter which booster you got originally, or which vaccine you got originally. You can get any manufacturer vaccine in the booster.
So if people got a Moderna and they want to keep it that way, they can simply ask for that.
They
Mhm.
can,
I've had that question.
depending on where they are, because not everybody is offering all types of the vaccine. The last time I checked, the county was only offering the Pfizer as a booster, so that may have changed since I spoke to them last, but, availability depends on what the particular place is offering at the time.
No, I have another question that's been asked of me. People are asking me, is there a time safe enough between a booster shot, a flu shot, and a pneumonia shot? Is there county health recommending a time, like a week or 2, or
What-
anything like that?
What we're being told is that those shots can all be given at the same time. There is no time that has to be wait in between the vaccination of those shots.
So it would be good for people to ask their own physician then?
Right.
Oh, okay. 'Cause funny, I get that question,
Yep.
when but anyway, I did. Okay, so
Yep.
that's good.
There are certain towns, I think, that are offering the flu vaccine with the booster, with the COVID. So I know the flu. I was not aware that the pneumonia one could be, but I'm sure.
I think that pneumonia shot, and I'm not gonna try and say the whole word, because I probably sound pretty funny. But I understand some of the older people want to get that shot if they're like 2 years or 3 years since the last time, even though it's effective. They go to their physician to ask if they should get another one. You know, even though the time period seems to cover them. And so that's been a little bit of a question of mine too, which I have referred them to their own physicians, but I'm glad that you had some comments on it, you guys got some comments on it, that's important.
I had a question in regards to the in-school vaccination clinic that you said you were gonna meet with the nurse, and then kind of gather more information from there on. So we don't know any, like, further updates about it or anything,
It
correct?
just came up this afternoon. It was
Oh.
just requested this afternoon, so
Okay.
we didn't, we weren't, as far as the regular COVID vaccine clinics, a lot of that was coordinated through Community Health Center and VNA. We're going to work with VNA definitely on these school ones.
Right. I think I'm just kind of like expecting parents kind of bringing up an issue with it if it's in school and stuff, which is why I kind of was curious if we had any further information about it, so.
And that brings another question to mind that I've been asked. The flu clinics that we always had at the church. Will
Right.
we resume that, or?
Yeah, we've done one already, and we did 128 people, and that was on October 26th.
Yeah,
And November 10th, we have our second one,
yeah,
and that one will be from 3 to 6 at Christ the King.
very
So we
good.
do have the second clinic already scheduled, and it's been advertised.
Excellent,
Okay, great.
excellent.
So hopefully we'll get at least another 100 people, and that'll keep us in line with we do about 225 to 230 people a year over those two clinics.
Beautiful.
Oh,
The
that's
first
great.
one went really well, so we're hoping the second one goes smoothly too. At the second one, we tend to get more teachers because it's after school, and hopefully more folks who can get out of work between 5 and 6.
Good,
Yeah,
So that's kind of why we do an afternoon one.
nice,
yeah, that's perfect.
excellent,
All right, thank
Excellent.
you.
very good.
All right.
Okay, I guess, Glenn, what do you think we should do next tonight? What do you think we should do next tonight?
Santuit Pond Survey, I think, is all we have left.
Okay,
Well, as you know, there's going to be a joint meeting with the selectmen Monday night, and the topics there is going to be surrounding the survey that we're doing around Santuit Pond for the 100-foot and 300-foot septic inspection and septic pumping requirement order letter that we sent out. And we do have, we've prepared two memos, and we have another letter, which is a follow-up letter, which will be sent out now that we're at the end of the, basically the enforcement period of that initial order letter. So the numbers, there's 121 abutters, and at this point, we have there's 60 properties essentially that have either done, that are fully compliant or have done the pumping requirement.
The
And-
inspection.
And the septic inspection. So we have 21 additional properties that we know that have pumped, but we're waiting on septic inspections. So, and we're also being told by the septic inspectors and the pumpers that they have people scheduled into November, because there just wasn't enough time to do all 121 with those inspectors that are available and the pumpers with their own schedules. So we know that this is taking additional time, but within the, right now we have 16 failed systems, but 7 of which we knew because they were cesspools, so they were automatically failed based upon our regulation once we gave the order for the septic inspection. So there will have to be some decisions made as far as when and if those systems are upgraded, and that's kind of what the discussion, I think, will be on Monday night, on how to move forward based upon the sewer phasing that's coming up and the funding that's coming up, so that the timing of that, I think, will all be discussed. But we did forward these memos to you, so you can review them over the weekend. And Christine and I will have more information, and we'll have other stuff broken down for come Monday night for that meeting. So the second memo, what was done, there was a request for the to explain what the Board of Health's authority was to fix the septic systems. So I wrote up a memo and broke down the basis of Title V on what the board's authority was, which you have a copy of. And in that, I discussed both the Santuit Pond abutters and the time frames that are required. Those systems that were Title V systems essentially have 2 years to fix the, to get the systems upgraded. But there's also, in May of '23, there is going to be a request to get Phase 2 sewering approved at the Maytown meeting. And this is per the chair of the Sewer Commission, and Select Board member Gottlieb came to our last meeting and explained the phasing to us, and that funding would be requested at that time, at that May 23 town meeting. So that depending if and when that money is made available for the next phase, as the Santuit abutters are now in Phase 2, that would allow the Board of Health to issue an actual extension up to 5 years should that money be made available, because there has to be a sewer plan in place and there has to be a fiscal commitment from the town to install the sewers. And if that's done come May 23 town meeting, then the board could actually extend out those upgrade timelines to actually connect up to sewer when it is made available. So again, if right now there is no fiscal commitment for Phase 2 and we know those failures exist, the board could essentially order the upgrade for those systems now. But again, I think this is going to be the discussion come Monday night based upon the phasing of the sewers and the funding that will be available, and come Phase 2, and what to do at that point. And the letter, we have a final notice that we're going to send out, because as I said, we're at the end of the enforcement period. There are some people who we just have not heard back from at all, who have dug their heels in and said, we're just not going to comply. So we're going to give them one more shot, 7 days, to give us some kind of response. After that, we'll issue fines.
Okay.
My only question and concern is that we do not concentrate on one area, no matter when the sewer goes in, any area. If we're gonna set a requirement, I really think we need to talk an awful lot about how we're gonna set one requirement for one section and another requirement for another section and another requirement for another section. I just think we're gonna need a very long debate on how we're gonna handle something like that. Because I see a future of opposition because everybody knows there's a sewer coming. And that can be pretty challenging to a board like us to say, well, you live in, you live high in a mountain in some part of town, and you're not gonna get sewer for a long time, but your system's no good, you gotta fix it. But you're gonna get a sewer too.
Yeah.
I think we're gonna have an awful debate on how we're gonna handle something like that, because and as much as I think is it's totally wrong to allow systems that do not work to continue to be able to not find them and not stop it and get them fixed. I mean, my view personally, I don't care when you're getting your sewer, you're fixing your system now. And I'll probably be the only one who says that, but I don't care. What's fair is fair. You can't just keep polluting while you're waiting for a polluting Band-Aid to come along. I don't know. People ain't gonna like me, but I'm gonna sit here because they like me, so I don't care.
I think I agree with you to an extent with that, because I feel like, of course, we don't know when the plan is gonna be in motion with the sewers and everything. Of course, that's still things that are being discussed. Everything is kind of up in the air for a concrete decision. So I feel like if there are failed systems that are continuing to, pollute and stuff like that, I think I would say the same thing, where, you get it fixed until the sewer gets put in, because we don't know, we don't have an exact timeline when we move forward with this project, and everything, we always have to anticipate things messing up or something going wrong, and budgeting might not work out,
I
or
agree with you more.
some things will always happen, so I do agree with you on that.
I mean, really, you gotta face the facts here.
Yeah.
The fact is, your system's no good and you're polluting.
Right.
Okay, yeah, you're gonna get a sewer, so ain't I. And him, and him, her and her. But that means nothing to me. Only thing that means anything to me is you're polluting. Your system is NG.
Okay?
Oh, I'm sorry, but that's enough.
I think my concern was in regards to those houses that did not get, or the properties that did not get back to us. Is it something like we kind of know that, okay, these are fully, resided in houses, or, do you know what I mean? Like, of course, it's a lot of work to have to kind of figure that out, but is there a way we know why? I feel like I'm trying to look at circumstances beyond why they wouldn't come back with an answer.
Well, they've received the notice,
Okay,
so they're just not complying.
okay.
I mean, we do have a situation where there was one property that is essentially abandoned right now.
Right.
A woman bought the property and then had work done, and the contractor defaulted. And so property has basically sat fallow for 15 years. And so, at that point, that property has not contributed to the, any of the issues because there's been no septic flow there.
Got it, okay.
So,
There is a small number of properties that have not had proper notice, but we're, researching updated address information and,
Right.
but until we know that, but when we get the contact information, if they have an off-Cape address,
Mhm.
it's pretty safe assumption that they're not occupying the property
Right,
year-round. I mean, they may be occupying it more because of COVID, but, that's essentially, I think, the best way to tell if it's a year-round is if somebody has an
Right.
off-Cape address.
Right.
But some of this, I think there's something in the memo about how many properties we didn't get returned, we got returned undelivered.
Right, right.
So those definitively, we have gotten
Okay.
notice back that they haven't been delivered. I don't know what percentage of those got the first class, because some folks may not get may not sign for the card, but they will get the first class, but it's just a lot to keep track of, so
Yeah,
we just kept track of the certifieds.
okay,
So, but that's just a relatively small number, I think,
yeah,
under 15.
yeah,
Who-
I think it's 14 properties.
Yeah.
yeah. Yeah, I was just looking at the numbers. Yeah, I feel like with like COVID happening and everything, I just kind of think like, oh, have somebody like vacated the house for the time being, if they're like in Florida or something like that, and they haven't come back, and which is why, so I just kind of wanted to know how we are kind of keeping track of vacated property, like property versus not, just like you said, for that one house, so that's fine,
We run into all different situations.
of course, yeah. All right. We don't have to do, no motion or anything in regards to this, correct? It was just like an update. And so, okay.
Do you have anything else that okay.
We good for tonight? Have we covered what you'd like to cover? You all set, Ann?
Yep.
All set?
I'm good, thank you.
I would accept the motion to adjourn.
Yep, I make a motion to adjourn the meeting for November 4th at 6:48 PM.
I'll second that.
All right.
All in favor, please say aye.
Aye?
Aye. Any opposed, any abstain? Thank you.